أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. My dear friends, fellows, students appearing in FCPS examinations or any examination in the country or outside the countries. Now we are actually dealing a serial of lectures on the infection and the disease, and that is what is called infectiology. The subject is a very long one. I will say very, very long. It is important in any case if you are a physician or whatever you are. Now you should know the disease and patterns and the clinical features, how to diagnose it and how to manage it and how to prevent it. Now these are the basic templates of any disease is concerned. Disease means disease. It is in your country. It is possibly sporadic cases. In other areas of the world, it may be endemic or sub-endemic, or in certain areas, it is more than endemic, hyper-endemic. Possibilities are there. For example, you are posted in Zimbabwe or other countries around Libya, or you are posted around Egypt around as a medical officer or any specialist. Now these diseases which I am telling you, and I am calling what is called Spirochetes, and one genus is Trypanosomes. The Trypanosomes mean disease is syphilis. Trypanosoma pallidum subspecies pallidum. Trypanosoma pallidum pallidum. Syphilis, I have already talked about it. Although my talk was limited of 1.5 hours, and it is quite dry subject. These are dry subjects. According to most of my friends, they said that these are very dry, and because they have not seen these cases. So the thing is this, if you have not seen these cases, even then, HIV at one time was the most important disease, which were asked usually from 2000 to 2020. In 20 years, they are asking in the examinations. In 1998, they are putting questions on HIVs. Disease was not usually seen in your country, or it is not diagnosed properly in your country. Doesn't mean that the disease does not exist. So something about the rare diseases of trypanosomes, and one is Yaws, other was the Pinta, the Beagle, and non-venereal type of the trypanosoma. These are the other diseases. The importance of the disease is this, that there may be the differential diagnosis of many diseases. And that is why it is mimicked the other diseases. You have to rule out these diseases. I am Professor S.D. Heather. I am honorary global professor of medicine without any name or any fame or any economics. One thing more is that those who are appearing in FCPS 1 examination, remember that the pathology will be asked. Some part is general pathology, some is special pathology, some of them, and some are related with purely the microbiology, whether it is bacteriology or whether it is parasitology. So you cannot run from it. You have to learn. Even the rare diseases you should know, because the questions we made usually are questions which are 10% questions are those questions which are not acceptable by the candidates, or even they are so much difficult that they cannot be solved easily by any of the person who know or who have learned it, the infection, the disease, for example. These 8 or 10 questions are always confusing questions because you are not known to it exactly. This is the problem, because nobody has actually achieved the full marks. It's MCQ, and 100% marks can be achievable. I have not seen any case who have achieved 100% marks. 95, yes. 94, 93, yes, it is possible. Because 10 or 8 questions in each paper is very questions are very difficult, or very close questions. Meaning that the choices are very close. You have to, you hover in your mind what is the possibility. So we talk now about a rare disease which is called Yaws. Now Yaws is a rare disease. It is related to the Trypanosomes genus Trypanoma. Remember, there is a tropical infection. It means that it is mostly seen in the tropical countries. Of the skin are involved, the bones and the joints are the chief targets of this disease. And the etiological agent is Trypanoma pallidum partini. Trypanoma pallidum partini. Incidence in the world is common in 13 tropical countries. 85% usually are seen in 3 countries: Ghana, Papua New Guinea, and Solomon Islands. The disease only infects humans. Although the 18th century French historian Pierre Francois Xavier Charlevic described it as a disease among geese and thales, and some of the species also other than humans they are involved, and decreased the number by 95%. In them, cases have increased, but with renewed efforts to globally eradicate the disease by 2020. Most of the countries, they have eradicated this disease. Although this disease is present nowadays also, because the number of people infected was estimated at more than 500,000, means a big number. In 2016, is concerned, the number of reported cases was 59,000 only. It means the disease has decreased by 70%. Because of they have started working in these places, health awareness, media is involved, and those people who have got some skin infestation should immediately report it to the area involved. Although one of the first description of the disease was made in 1679 by Willem Passu, who is archaeological evidence suggests that the Yaws may have been present among the human ancestors as far back as 1.6 million years ago. So it is an ancient disease actually. It is not diagnosed properly afterwards. That is why it was described afterwards in the, you can say, in 19th century. It is described in the literature. Now this is the incidence in the world. Now this one, color, this color, and this color, and this color, where incidence is more. Now here you see, it is seen in most of these areas which I have just mentioned out. The New Guinea and the Solomon Islands, etc. And this is the part of the Africa where these diseases are seen. But as far as Pakistan is concerned, is actually the work has not been done. Work has not been done for all population. We don't know whether the disease occur in your country or not. But in India, 1 or 2 cases have been identified as Yaws. Because I'm expecting Yaws when there is a positivity for the screening test of the syphilis is constantly, they are positive and positive. That is non-troponemal test, screening test. And when we go through and ask those persons who are infected whether this is, whether you have any sexual contact, they denied. And the tests are positive and positive and positive. Even the troponemal tests are positive in certain conditions. In certain cases. So it is a questionnaire, a question in my mind, why they are positive and positive and positive when there is no lesion is found. Yaws is spread by the direct contact with the fluid from the lesion of an infected person. It is a person-to-person transmission. And it is not zoonotic disease. The contact is usually of a non-sexual nature. It is not the STD or venereal disease. The disease is most common among children who spread it by playing together. So, the clinical features are divided into, as for the syphilis, the primary, secondary, there may be mixed features, latent, tertiary, and one disease is very important, rare although, is a rhinopharyngitis mutilans. Primary syphilis is a painless, distinctive mother. It is called mother. It is usually the initial lesion. Nodular lesion appears. Initially it is reddened and inflamed and then became a papilloma afterwards. It can then become an ulcer, ulcerated, possibly with a yellow crust. The mother yaws are most commonly found on the legs and the ankles are rarely found on the genitals, which is unlike syphilis. Mother yaw enlarges and becomes warty in appearance afterwards. And these are the stages of the mother yaw. Nearby daughter yaws may also appear. Around and very near to the mother yaw lesions, there are daughter yaws simultaneously. This primary stage resolves completely with the scarring. This is important. It is not resoluting, it is scarring. Within 3 to 6 months, the scar is often pigmented afterwards to disfigure the person. Now these are the few pictures seen on the lip. You see, this is another one, the mother yaw, the daughter yaws around it. This is the mother yaw, daughter yaws, daughter yaws, daughter yaws. Stages are seen as nodular and then papilloma ulcerative forms. Even a big fungating mass is seen in these conditions. And because it is organized by the fibrosis, and after fibrosis there will be pigmentation also. Look, the pigmentation. Yellow pigmentation. It is disfiguring the person. Another way, on the secondary yaws typically show the widespread skin lesion that will vary in appearance, same as in syphilis. In the secondary syphilis, same, including the crab yaws, areas of the skin of the abnormal color. Different type of colors are seen on the palms of the hands and soles of the feet, named for the crab-like gait, just like a crab because of the pain of the hands and the sole and the upper ankle. The person's gait is abnormal. It is a crab-like gait. The pimple shows to him. This may show desquamation. These secondary lesions frequently ulcerate and are highly infectious, but they heal after 6 months or more. Secondary yaws infect the skin and the bones. It penetrated from the skin to the suprapubic fascia, deep fascia, and entering the bones. The most common bone-related problem is periostitis, inflaming the different parts of the body and inflammation around the bone. Remember, if the periosteum is involved, it is very painful. Often occurs in the bones of the fingers and the long bones of the lower arms and the legs, causing the swollen fingers and limbs. That is called dactylitis. This causes pain at the night and thickening of the affected bones. That is periostitis, that is. About 75% of the infected children surveyed in the endemic areas reported joint pain. The swollen lymph nodes occurring with the fever along with the malaise are also common because it is an infective disease. So the acute infection that cause and is causing the fever, the skin lesions, the malaise and arthralgias. And these are the secondary yaws. Primary yaws should occur before it. And then after 6 months afterwards, and these lesions are developed like this. The different type of pigmentations are seen. You can see this area is involved in the legs. And because it is involving, it is very painful because this type of the lesion involving the deeper tissues, compartment syndrome can occur. Even the bones are involved, and it's painful gait and a crab-like gait. Another variant is the latent or relapsing secondary. It is secondary although the person was actually in the healing phase and healed. After primary and secondary yaws, and possibly in some cases without these phases, a latent infection develops, just like the latent syphilis. Within 5 years, rarely within 10 years, it can relapse and becomes active again, causing further secondary lesions which may infect the other people. These relapsed lesions are mostly commonly found around the armpits, mouth and anus. But then look, the areas are armpits, now mouth and anus. All 3 areas are very, very important, painful areas. There will be proctalgia if it occurs in the anal canal, in the mouth. You're difficult to eat because it's a painful condition. The armpits, you cannot raise the hand properly. Now these are the relapsing stages. Healed, and then again the eruption occurs. Look, the lesions of the different parts of the body. The coloration are also different. Some are yellow crusted, some are pink crusted, some are white crusted. The tertiary yaws, yes, just like the tertiary syphilis. Thought to develop the tertiary symptoms, but more recently the tertiary yaws has been less frequently reported because of the health awareness. They actually manage the secondary yaws. Extensive therapy has been given, and there is rarely it is seen. The tertiary yaws can include again the same thing as the syphilis, the gummatous nodules. It most commonly affect the skin, but in syphilis, the gumma can occur any part of the body, in the liver, the abdomen, and elsewhere. The skin of the palms and soles may thicken. That is important as hyperkeratosis. Nodules ulcerating near joints can cause tissue death. Periostitis can be much more severe than the secondary yaws. The shin bones may become bored. That is called subluxation from the chronic Spirochetes. Osteomyelitis usually is not seen. Usually it is very astonishing, very interesting and astonishing also. The bones inside is not involved. Yaws may or may not have the cardiovascular or neurological effects. Definite evidence is lacking. The research says that is very rare. Any cardiovascular type of yaws or the neurological yaws is usually not seen. Another variant is the rhinopharyngitis mutilans. It is called gangosa. It is a rare region, although destructive ulcerative region that usually originates about the soft palate and spread into the hard palate, nasopharynx and nose, resulting in the mutilating cicatrices and outward to the face, eroding the intervening bone, cartilage and soft tissues. Destructive regions in the mouth connecting to the nasopharynx, and that whole area is involved. Just like the carcinoma, nasopharyngeal carcinoma, it spread. It occurs in the late stage of yaws, usually 5 to 10 years after first symptom infection. These are the late stages of the yaws. It occurs after 10 years, but it's a rare one. This is the now rare, very rarely yaws may cause bone spurs in the upper jaw near the nose. That is called gondao. Spurs, bones, the outpouring of the bone. And the gondao was rare even when yaws was a common disease. Rare disease also gondao, but it is alarming situation because yaws is protruded out. And these are the families which are involved with the rhinopharyngitis mutilans. You see, the whole face, the teeth, the nose is gone, and the thing is that it is the disease which is very mimicking the carcinoma, spreading from the mouth or from the gums or from the nasopharynx, just mimicking it. In the first instance, it looks like it is a carcinoma, but after investigation, it is clear that it is not the carcinoma, but direct evidence shows that it is some type of organism which is spiral in shape. Diagnosis can be done. The gold standard again is the dark field microscopy. Lesion histopathologically will be examined, and dark field microscopy should be done. You see these in the culture is difficult, although in the high power microscope, the spiral shape bacterium gram negative you see. This is the gold standard. But the other is a microscopic examination of the what is called histopathology. You see the hyperkeratosis epidermal, papillomatosis, and you see the influx of the neutrophils and the plasma cells, and afterwards the fibroblasts, and the density may cause the micro abscesses. You stain with the Warthin starry or Levitati silver stains, selectively stain Treponema pallidum, and direct and indirect immunofluorescence and immunoperoxidases and polyclonal antibodies to the Treponema pallidum can be done. Serology can be done. A range of the treponemal, non-treponemal assays, they become positive. And treponemal tests are more specific and positive for anyone who have been infected with the yaws. They include the treponema pallidum particle aggregation tests, just like TPHA. And non-treponemal assays can be caused to indicate the progress of an infection and cure, and the positive result weaken and may become negative after recovery. After the case is treated early, they include the venereal disease research laboratory test, the VDRL that is called. Requires microscopy and rapid plasma reagent naked eye result test of both of which flocculate patient-derived antibodies with antigens. So you can differentiate between the Yaws and the Pinta and Vigil and from syphilis, whether specifically you do the PCR and DNA probe test sequencing. It will separate this disease from the very, very mimicking disease or syphilis. You can do it. And this is the investigation has been done. When you see this one. This is the inflammation of the joints, and this is dactylitis of the secondary Yaws because of the Spirochetes, and it is the histopathology seen epidermal hyperplasia. If you see in the and stain with the Vartinus starry stain, silver stains, then you can pick in the high power microscope the infecting organism. And this is the X-ray done, and you see to read this X-ray, try to read this X-ray. Now see, this is the X-ray of a child of the secondary Yaws. Look, the hyper density around the bone. All of this part, the bone is inside is not involved. You see these markings. Look, these markings. This is the linear markings on the metacarpals. Metacarpals, they show there clearly that it is periostetis. Management is done like the syphilis, long-acting benzathine penicillin can be given, or less commonly the course of other antibiotics. If it is not suitable, it is not available, you can go for azithromycin or tetracycline tablets. I like to use the doxycycline in this condition. Penicillin has been the front-line treatment. In 60s, there is no solid evidence on the evolution of the penicillin resistance in Yaws is concerned. It is a good thing, because penicillin you give first dose and then second dose, and then monthly to suppress the condition, and even the eradication can occur. The historical strategy is that in hyperendemic areas, where more people are infected than the immune persons, only 10%. Benzathine penicillin to the whole community has been given, total mass treatment, TMT. Mesoendemic means 50% are immune, 50% are infected. Treat all the active cases under 15 active cases, and all contacts of infectious cases, juvenile mass treatment, JMT that is called. If it is hypoendemic, means that 95% are immune and only 5% are infected. Treat all active cases, select them, isolate them, and then manage them. If there are any contacts, then you have to manage the contacts also. It is SMT, that is selective mass treatment. The total mass treatment, there will be juvenile mass treatment, and there will be selective mass treatment. Now see the secondary Yaws in the armpit, and this, which I already said, that is a very painful condition. You cannot lift, you cannot walk. The same person which I have shown you as a periostetis, 2 weeks and 3-5 after single dose of azithromycin. Look at the effect of the azithromycin, which is given in the full dosage. Only single dose was so much effective that this condition is converted like this. Even it is all not visible here. Single injection of penicillin was given, and look, the face of this person, look after 2 weeks, the face is cleared. It is very, very highly effective management. There is no disease in the world in which of this nature that you give only single dose and the patient will be cured. Prevention and eradication is important. WHO efforts against this disease is definitely very important. Health awareness is important. The context should be sought out and this should be managed accordingly. So this is the disease which I have discussed actually. Although the people do not want for the discussion of this disease. I have actually discussed because you should know about Yaws, because it is the number one, it is the infection which should be actually mimicking any infection, any of the condition. There is a lot of differential diagnosis. And secondly, anything can be asked in the examination. You cannot challenge the examiner. He can ask about yours. For example, in Sudanese examiner was invited in CPSP. He was interested only in parasitology, or he is a clinician. And these diseases, that is Yaws and Pinta and Beagle, etc. He asked the person, the candidate, about the Yaws. He said that, do you know what is Yaw? It is what is this disease? It is a malignant disease, or it is an autoimmune disease, it is an infective disease. What is this? What is the classification? How it occurs? These were the questions. And the candidate was silent in front of him. So he said that because of these rare diseases, I have not studied. He said, examiner said that, no, this is not the answer of my question. If you are becoming an internist now, a physician, consultant physician, you should know everything about it, every rare disease. So this was the answer given by the examiner, a Sudanese examiner, and that is why I am telling you that these are the rare diseases, although they can be asked in the examination, and that is why I have actually taken these tutorials. So something is better than nothing. If you know something about it, you can tell him. وما لنا إلا البلاغ. السلام عليكم ورحمة الله وبركاته.